Hello and welcome back to my channel. Today we're going to discuss patellofemoral pain syndrome, also known as runner's knee. This condition is a common cause of knee pain, especially among athletes, but it can affect anyone, regardless of their activity level. We'll cover what patellofemoral pain syndrome is, its symptoms, diagnosis, and management strategies to help you better understand and manage this condition. Hi, I'm Dr. Knapp, here to bring you medical information so you can take control of your health and make the most out of your doctor visits. Let's get started. Patellofemoral pain syndrome, or PFPS, refers to pain originating from the joint between the patella, or kneecap, and the femur, or thigh bone. This pain often results from increased stress on the patellofemoral joint or abnormalities in how the patella moves over the femur. Activities that involve repetitive knee bending, such as running, squatting, or climbing stairs, can exacerbate this condition. It's commonly seen in athletes but can also occur in non-athletes, particularly those with structural or biomechanical issues in their knees. The exact cause of PFPS can vary, but it's often linked to overuse, muscle imbalances, or structural abnormalities. Overuse injuries occur when the knee is subjected to repetitive stress without adequate recovery time. Muscle imbalances, particularly in the quadriceps, hamstrings, or hip muscles, can alter the alignment and movement of the patella, leading to increased pressure on the joint. Structural issues such as a high-riding patella, flat feet, or misaligned lower limb can also contribute to the development of PFPS. The primary symptom of PFPS is a dull aching pain in the front of the knee, around or behind the kneecap. This pain is often aggravated by activities that put stress on the knee joint, such as running, jumping, squatting, or climbing stairs. You might also experience pain after sitting for long periods with your knees bent, a phenomenon sometimes referred to as the theater sign or moviegoer's knee. Additionally, you may notice a grinding or clicking sensation when bending or straightening the knee. Swelling is generally not prominent in PFPS, but in some cases mild swelling may be present. Diagnosing PFPS typically involves a thorough physical examination and review of your medical history. Your healthcare provider will ask about your symptoms, activity level, and any recent changes in your exercise routine or physical activity. During the physical exam, they will check for tenderness around the kneecap, assess your knee's range of motion, and observe your gait and movement patterns. They may also perform specific tests such as the patellar apprehension test or Clark's sign to assess patellar tracking and identify any abnormalities. In some cases, imaging studies like X-rays or MRI scans may be ordered to rule out other potential causes of knee pain, such as fractures, arthritis, or cartilage damage. While these imaging tests are not typically necessary for diagnosing PFPS, they can be helpful in confirming the diagnosis or identifying any underlying structural issues that may be contributing to your symptoms. Managing PFPS usually involves a combination of rest, physical therapy, and lifestyle modifications. The goal is to reduce pain and inflammation, correct any underlying biomechanical issues, and strengthen the muscles around the knee to improve patellar tracking and stability. Rest and activity modification are important first steps in managing PFPS. Avoid activities that exacerbate your symptoms, such as running, jumping, or squatting, and give your knee time to heal. In some cases, temporary use of crutches or a knee brace may be recommended to offload the knee and provide additional support. Physical therapy is a cornerstone of PFPS management and can help address muscle imbalances and improve knee mechanics. A physical therapist will design a personalized exercise program to strengthen the muscles around the knee, particularly the quadriceps, hamstrings, and the hip muscles. Strengthening these muscles can help improve patellar alignment and reduce stress on the patellofemoral joint. Stretching exercises are also important, especially for the quadriceps, hamstrings, and iliotibial band, to improve flexibility and reduce tension on the knee. Therapeutic exercises for PFPS typically include a combination of strengthening, stretching, and proprioceptive exercises. Strengthening exercises may involve straight leg raises, quadricep sets, and step-ups to target the quadriceps and hip muscles. Stretching exercises can help lengthen tight muscles and improve flexibility, while proprioceptive exercises such as balance training or using a wobble board can enhance knee stability and coordination. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any topics you want discussed in future videos. Anyway, in addition to physical therapy, certain lifestyle modifications can help manage PFPS and prevent future flare-ups. Maintaining a healthy weight can reduce stress on the knees, while wearing supportive footwear and using orthotics can improve foot alignment and biomechanics. Gradually increasing the intensity and duration of physical activity can help prevent overuse injuries. It's also important to incorporate cross-training and low-impact exercises such as swimming or cycling into your routine to reduce repetitive stress on the knees. Pain management is another important aspect of PFPS treatment. Over-the-counter pain relievers such as acetaminophen or nonsteroidal anti-inflammatory drugs, or NSAIDs, can help reduce pain and inflammation. Applying ice to the affected knee for 15 to 20 minutes several times a day can also help alleviate pain and swelling. In some cases, your healthcare provider may recommend a corticosteroid injection to reduce inflammation and provide temporary pain relief. For individuals with persistent or severe symptoms that do not respond to conservative treatment, surgical options may be considered. Surgical procedures for PFPS are generally reserved for cases where there is a clear structural abnormality or significant damage to the patellofemoral joint. Surgical options may include lateral release, which involves cutting tight ligaments to improve patellar alignment, or realignment procedures to correct structural issues in the knee. These surgeries are typically followed by a comprehensive rehabilitation program to restore strength, flexibility, and function. Long-term management of PFPS involves ongoing exercise, stretching, and activity modifications to prevent recurrence. Regularly performing the exercises prescribed by your physical therapist can help maintain muscle strength and flexibility, improving knee stability and reducing the risk of future flare-ups. Monitoring your activity levels and gradually increasing the intensity and duration of physical activities can also help prevent overuse injuries. It's important to listen to your body and avoid pushing through pain, as this can exacerbate PFPS and lead to further injury. If you experience a recurrence of symptoms, it's essential to seek medical evaluation and adjust your treatment plan as needed. With proper management and preventative measures, most people with PFPS can achieve long-term relief and return to their normal activities without significant limitations. Thank you for watching. As always, take care of yourself and make the most of your day.